Hey guys, it's Joanna Vargas. I am really excited about this live today. I have a very special guest. Uh, I have a very incredible dermatologist that's going to join us. Let me just get him in here right now. All right, here he is. Technology. We did it.
How you doing?
Hey!
You got it to work.
Everybody, I'm so excited to host my special guest today. This is Josh Zeichner, Dr. Josh. Josh, you want to tell us, where you practice,
Sure.
a little bit about yourself, so that we can kind of all enjoy all your credentials.
Sure. So again, I'm Josh Zeichner. I am a dermatologist on full-time faculty at Mount Sinai Hospital in New York City. And I'm really fortunate to have a broad practice treating a lot of acne and rosacea, a lot of cosmetic issues, and really lucky to work a lot with the media, which, Joanne, I know you do too. So I read about your name all the time.
Thank you. That's really nice of you. I am just pinning your Instagram because already people are asking uh, what your Instagram is. So I want to make sure that it's up so that people can follow you once we are done with our little chat. Um,
I posted you a thumbs up.
bear with me. Typing with one hand is not my forte.
So I
It's
actually have a stand for my phone now because the office is closed with everything going on with coronavirus, with the exception, of course, for emergencies. So I switched all of my patients over to virtual visits.
That's so awesome. So how has
Yeah.
that been going? Have patients been really reaching out a lot to you?
Yeah. So was a little bumpy at first, but we've been doing it for about a week and a half, and now we've really got it set. It's a great option for people who have issues like acne and rosacea. They have a new rash or a spot. Of course, COVID is at the top of everybody's mind,
Yeah.
but we can't forget about, the regular care that everybody needs for their general health.
Well, don't you think right now more than ever we need to focus on doing what makes us feel good and keeping up with everything that would maintain our outlook on ourselves? I mean, I think for me, self-care is all about, if you feel good on the inside, then you're going to be a healthier person, you're going to be happier. And I think that that's important now more than ever. What
Yeah,
do you
we're all quarantined in our homes, and I think it's important to have some sort of escape from the reality of what's going on. Of course, have it in the back of our minds and be aware of it, but we have to take care of ourselves. We can't just fall apart, as we're staying home.
Yeah, I think self-care is always important, but now more than ever, for
So, what have you
sure.
been doing? What's your big self-care routine that you've been doing at home?
Well, I definitely have been doing my Peloton bike every day
Yeah,
because that's something I can do at home. I take walks. My dog. I have a backyard, but we've been walking the dogs around the neighborhood just to
yeah.
kind of get some space. It's so unusual to be in the house so much of the day that I find that a walk is very therapeutic. My skincare routine obviously is pretty on point always.
It's got
So,
to be.
but I think just those kinds of things, making sure that mentally I'm having space and doing things that make me feel healthier. Are you able to exercise at all at home?
Yeah, so I actually got the mirror. Have you heard of this thing?
Oh yeah, how is
So
it?
I love it. So, I live in Manhattan and I have one actually in my bedroom. And when all this happened, we actually left the city. I've got two young kids and I wanted to make sure that they were safe and healthy. And what the Mirror did is that they actually changed their system over, and now they can stream directly through your phone on the app. So So
Oh,
that's what
that's
I've been
great.
doing. I was a little worried for a while, but they launched that and it's been great.
That's really cool. Yeah, it seems really cool. I've never tried it before, but it always looks good to me.
I need the
So
motivation.
I I can't work out by myself. I
Yeah,
mean, I don't think anybody works out as hard by themselves as they do when they are um, being instructed on how many reps or how hard to go on the bike
exactly.
or any of that. So for sure, it's definitely like a nice privilege to be able to do that. So a lot of my followers typed in questions already that I wanted to ask you that I thought were really thoughtful. So
Yeah,
let's dive into some questions, yeah?
yeah, for sure.
So the first question that someone asked is, can you explain the difference between Fraxel and Clear and Brilliant?
Sure. So those are two of my workhorse lasers in the office. They actually are really similar. I call them kind of the big sister and the little sister. So they use exactly the same type of technology. They're actually made by the same company. The way that fractionated resurfacing lasers work is that they punch microscopic holes in the skin, creating controlled wounds and allowing the skin to heal itself back up. So the question is, how deep are those wounds and how dense are those wounds? The Fraxel laser gives you deeper and more dense, fractionated treatments to the skin, and the Clear
So
and
does that
Brilliant
mean you have more
kind of
wounds
dots.
like in a littler space? Is
Exactly.
that
So
what you?
think about the art form pointillism. So I think we all know that Seurat painting.
Uh-huh.
Um, so from a distance, you see the image, but if you're up close, you see pixels. And that's exactly the way that the laser works. So if you look really closely, you're going to see these microscopic dots. Um, and those are all these channels of microscopic damage. The Clear and Brilliant laser has narrower channels and they don't penetrate as deep. So the advantage is that you really have very little downtime. I personally have gotten a Clear and Brilliant laser and then literally saw patients immediately afterwards. Um, you look a
That's
little
cool.
rosy, but
Yeah, I get kind of red. I mean, I get red very easily, but it's like fake because my
yeah,
skin can take almost anything. So it's
yeah,
just it doesn't mean anything for me to be red. But we do Clear and Brilliant in my office as well.
yeah. What do you think?
I recommend it to everybody. I don't know. How often do you recommend that people get Clear and Brilliant? I would really love to
So
hear your
I
take on that.
typically, I love for people to get one a month for 3 months,
Hmm.
and then every couple of months thereafter. I think it's a great option for people who are young and healthy. For people who don't have significant damage, if you have really bad, brown spots, you're going to need more than what the Clear and Brilliant can give you.
Sure.
But if you're, getting your facials, you're maintaining your skincare, and you're just taking care of yourself and adding this as part of your routine, I think it definitely over time can help maintain, the quality, texture, and tone of the skin.
So, what would the skin look like if you were going to recommend Fraxel? What would be different? Because I have melasma.
Yeah,
I'm Latin, so it's a very typical skin condition
yeah,
for
for sure.
a Latin person. And I get melasma, I don't go in the sun because obviously I'm an esthetician, but I get melasma even from overheating, like even if I'm in
It's
the
so funny you
shade.
mentioned heat. So there is a lot of talk right now about infrared radiation and infrared protection in many skincare products.
Hmm.
And there is a large body of data showing that. So really quick. So infrared is a wavelength of light or energy
Yeah.
emitted from the sun, but you also get it from heat sources. So you mentioned heat. So heat essentially is infrared. And there is a good body of data showing that heat by itself is associated with melasma. And there have been these studies looking at chefs who are just around the kitchen or people who are working at night. So they're literally sleeping all day, but they're exposed to heat. And that is really bad for the melasma and can rev it up and make it worse.
So my understanding, and you can correct me if this is totally wrong.
Sure.
I felt like my melasma, because I did go in the sun. I grew up in the 80s. Being tan was like, you put
Me
body
too.
oil on and, you know, bake. So I always felt like I had created cell mutation from the sun damage, and then the heat that I experience now triggers, I have that cell mutation, right? And then it just triggers that mutation to kind of go off in my skin and create the melasma. Is
Well,
that crazy?
we know that the sun damage that we experience when we're younger shows its face much later in life. So
Yeah.
everything that we experienced in the 80s is now, coming up. I'm in my 40s and I have all my friends from college, coming to me saying that they have these brown spots and they're looking old. Um, and it's, what we did so long ago. And
Yeah.
now, perhaps the skin is more sensitive or more reactive to triggers like heat because there
Right.
was that previous damage.
Right. All of this is so interesting to me because melasma is one of the biggest concerns I think
Yeah.
that people have today in skincare. And I always try to be very forthcoming with my clients that as an esthetician, there's really not, you have to see a dermatologist for
Yeah.
pigment issues. There's no magical facial that's going to, I'd love that. I'd be a billionaire, but like it just isn't going to happen with
The
topical
only
products.
instantaneous fix is called foundation makeup. But
Yeah.
look, melasma or the treatment of melasma is a marathon, not a sprint. You need good skincare. You have to be diligent in sticking to your regimen, and I'm sure you tell your clients this all the time. We're talking about protection in the morning
Yeah.
and repair in the evening. So I typically am recommending an antioxidant serum. So, for example, one that contains vitamin C, either by itself or with vitamin E, and
Hmm.
then a good broad spectrum sunscreen every morning. So I'm looking right outside. It is raining by me. I'm not sure what it's like by you.
Raining.
Raining, but even in the rain, and if you're sitting by the window, we know that UVA light penetrates through window glass and can
Hmm.
cause, sun damage. So you may not even think about it, but that incidental sun exposure can be harmful, and we need to protect ourselves every day. Yeah, and then
One
in the
question
yeah, go
that
ahead.
sorry to interrupt you, but I didn't want
No,
to
good.
forget. Once you get Fraxel, does it make you more sensitive to sun damage and radiation damage to your skin? Because I had a client years ago. She was a skin cancer survivor. She had a very serious form of skin cancer, but her dermatologist was saying, "Don't do yoga by the window. Don't go near the sun at all." After she had had a lot of laser treatments. Is that something that makes you more sensitive?
So I think in the short term, as your skin is healing from the lasers, you definitely are more sensitive in the first couple of weeks.
Hmm.
In the long term, the skin does go back to what it was before,
Okay.
but you spent all this money on lasers. You better take care of your investment.
I tell
So,
people that all the time.
like,
I
what are
tell
you
people
spending
that all
thousands
the
of dollars for
time.
if you're just going to go not wear your sunscreen?
Yeah,
But people
exactly.
really do. They look at the Fraxel as, like a silver bullet. They're going to say, okay, I'm going out in the sun and I'll just Fraxel myself.
Yeah.
But it's really important to take care of yourself and maintain that improvement.
I have another question about Fraxel and Clear and Brilliant, and then we'll
Yeah,
go on to other stuff because I have like
sure.
a whole list of questions here. Does Fraxel, in your opinion, work even if the skin tone is darker? Or should, if my skin tone wasn't what it is, I'm pretty fair, would it work on somebody with a darker skin tone? Because I think that that's another really big concern. I know earlier on in my career, lasers were not great for that, and dermatologists were less inclined to work on somebody, with
Get
darker
a color,
skin.
yeah.
Yeah.
So I've been using my Fraxel device for about 10 years now. And when it
Mhm.
first came out, we really used it just in our light skin patients and our Caucasian patients. But as we've had more experience with it, now we're using it in all skin types. I use it in African American patients. I use it in South Asian patients, in Latina patients. You just need to go to somebody who's experienced with the laser because you want to adjust the settings a little bit. And I personally pre-treat all of my patients with a skin lightening cream called hydroquinone. I'm not sure what your opinion of that is. We can get into that in a little bit. Um, but 1 week before of using this product is not going to lighten your skin. I think of it as calming down your pigment producing cells so they don't get upset after the laser. So it minimizes the risk of what we call post-inflammatory hyperpigmentation
Yep.
or developing, dark spots from the laser being used to treat your dark spots to begin with.
Yeah, so I don't know if you know this or not, but I do have a medical director
Yeah.
for my New York salon only, and she also recommends that um, just because it does turn it off or turn down that body response, and the risk of getting PIH, which is, post-inflammatory hyperpigmentation. Um, as a golden rule, as an esthetician, I'm not like a lover of people using hydroquinone on a regular basis because I don't think it's good for the skin like long term. But I think like if you're prepping the skin for a procedure, then I think it's okay.
So when I use it, I usually use it for about 8 weeks or so.
Hmm.
And usually it's kind of to get somebody where I want them to be.
Hmm.
And then once they're there, I do like them to stop as well.
Yeah. Um, okay, well all of that is like I think the most pressing. Is there a particular laser that you would recommend if somebody has acne scarring?
So I actually use the Fraxel for that as well. They're just different settings. So I have a laser called the Fraxel Dual. And there's what we call the thulium setting or the 1927, and then we have our 1550. So long story short, one of the settings penetrates much, much deeper into the skin. And we know that acne scarring is caused by irregular collagen down deep in the skin rather
Yeah,
than anything on the surface.
right.
So you need that laser to penetrate in there, cause a controlled wound,
Yep.
to that abnormal collagen, and then help it heal up in a more healthy manner. But the Fraxel, and then I personally am not doing CO2 lasers. Those are much more heavy duty. Those are the ablative ones that leave you
Yeah.
completely raw, for at least a week or so. But those can be helpful as well in some people with severe acne scars.
Would you be inclined if somebody had skin cancer on the face, would you be more inclined to recommend CO2 laser to kind of not just get rid of the scar? I mean, obviously that's one thing, but if somebody had precancerous spots on other parts of the face, would a CO2 laser be more where you'd go, or would you
No, I'll
more
tell you,
stick
actually,
with
it's a great
reflex?
question. So the Fraxel thulium, that 1927, is
Yeah.
FDA approved to treat precancerous sunspots known as actinic keratosis.
Uh-huh.
And I actually think that recently, at least over the past year, my largest group of patients getting the Fraxel laser are patients who are getting it for that sun damage. I can't
Yeah.
get it covered by insurance, um, but it's a very effective way of really improving the health of the skin. And of course, they get that cosmetic benefit.
Yeah, the reason why I asked is because I have so many clients in the past few years that unfortunately we've caught skin cancers on. And so a lot of Mohs surgery, a
Yeah.
lot of a lot of that going on. I think it's very common, unfortunately, these days. And so different derms do it in different ways. I have one client, she grew up in a very high altitude environment.
Yeah.
So, and she was an outdoors person, so a lot of sun damage. And I think high altitudes thin the skin as well, no? Because
And when
you're,
you're closer to the sun, there's data showing that flight attendants and pilots actually have a higher rate of skin cancer than the general population because
wow,
they're,
that's so
at
interesting.
10,000 feet.
That's really, so I have a friend who's an esthetician and she always recommends her clients close the window shade when they're
Oh, yeah.
flying,
But
which
it's really
I,
great that you're even aware of this. I'm sure that you are seeing faces of patients, just as much or even more frequently than I am. And I'm sure, just like hairdressers pick up skin cancers in the scalp, I'm sure you're seeing this all the time.
well, at the beginning of my career, I don't think so much. I think more so these days. I had one client, for example, she's an older woman. She was probably 71 years old. She had this red spot on her face, like right here. And whatever derm she was going to told her it was a pimple. And, 71-year-olds typically don't get pimples. It didn't look like a pimple to me. I'm not a doctor and I definitely stay in my lane. I don't try to be diagnosing anything, but I just kept on telling her I'd see her every month. And I was like, it can't be a pimple. It would have gone away by now. This doesn't
Yeah.
make any sense. And so I made her seek a second opinion. I didn't even think it was cancer. I just had no idea. Anyway, she went to a doctor and the doctor performed Mohs surgery immediately because it was
It
cancerous,
probably was a
unfortunately.
basal cell. Yeah.
And she wound up with stitches. They did the
The
flap.
flap.
It was quite a serious surgery. So after that, I think I became more cognizant of paying attention to little things that you see because estheticians you see people once a month for facials. It's um, it's important for us to pay attention, you
Yeah.
know.
I look at
Um,
patients like consumers of healthcare. You need to be your own advocate, and you need to seek out healthcare information. And if there's no harm in getting a second opinion.
yeah, and also I tell clients a lot, if something doesn't really make sense that someone's telling you, it probably isn't true.
Yeah.
Like for example, if somebody tells me that they have sensitive skin, estheticians laugh because lots of that.
Yeah.
But you have to take people at their word. You can't just be like, oh, well, I know better. You have to kind of like go with what the client is saying. And if a client is saying that something doesn't feel right on the skin, again, you have to respond to that and not just think like they don't know what they're talking about. I think clients know their skin the best, and we should kind of all respect that in some form or another.
Yeah. And I
Okay.
look, if you see something new or changing, get it checked out. That's it.
Totally. And like if you are like I'm 49 and so I spent, I think like 10 years baking in the sun. I get skin cancer checks on a regular basis and
Right.
it's a deep dive. I have never been, she checks like my whole scalp. It's like very she's very very careful with me because of all the sun that I had at one point in my life.
Yeah.
So those things are definitely important. And I don't know how you feel about this. I personally think that it's ideal for a client to have a dermatologist and an esthetician.
Yeah, I agree with you. I think that what you do and what we do can help complement each other.
Yeah, yeah, absolutely. All right, so I'm gonna move on, you guys. I mean, if anybody wants to, oh wow, we're getting a lot of a lot of questions. I'm going to address some of your live questions in a minute. You guys just hang in. I just want to ask Dr. Josh some other things from uh, the pre questions. Um, how long does it take to heal over exfoliated skin?
So I think it really depends on the person, and it depends how much exfoliating you've done. So we're talking anywhere from a day to a week. But if your face is red, burning, stinging, peeling, itching, perhaps you've done too much. You should hold off. Um, and usually you either do absolutely nothing or use a bland moisturizer.
Yeah, I was gonna say, ask you, do you recommend anything in particular to use on the skin while you're trying to heal it? If you've gone too far with a peel, especially these days, I feel like everybody at home is like trying out, like, I'll do a lactic acid peel. I've never done one and I'm in the house. So would you recommend anything in particular that could be
Yeah.
like
I
a
would say the
drugstore
ultimate
product?
multitasker is called Vaseline Petroleum Jelly. It's like $2, and you can use it everywhere from your lips to your elbows to over exfoliated skin. Now, of course, if you have oily skin or acne prone skin, you're not going to love, to cover your face in Vaseline. Um, but it really is the ultimate skin protectant. And if you don't want to use an ointment, you can get plenty of great bland moisturizers right from your local drugstore. everything from Aveeno to CeraVe, to Cetaphil, take your pick.
Yeah, I'm Latin, so Latin people love a vino.
Fine. Colloidal oatmeal has been shown to help protect the skin. It's great.
Yeah, it's simple and it's a drugstore product that it just happens to really work. I really like it. Oh, I thought this was a really cool question. How can you tell the difference between mild rosacea and overexfoliated skin?
So over exfoliated, or the redness that you experience from over exfoliated skin will go away if you stop exfoliating, but redness that you have from mild rosacea is going to stick around.
So what does mild rosacea, this is something that estheticians also hear a lot from clients. I have mild rosacea. What would you say are the signs that you have mild rosacea?
Yeah, so mild rosacea typically looks like redness or flushing in the skin, but I think that the real key distinguishing factor is whether the patients suffer from burning or stinging. Because oftentimes in rosacea, the face will burn, it'll sting, it'll flush more easily
Mhm.
um, than somebody else who's just fair skinned with a ruddy complexion.
Okay, because I definitely have fair skin with a ruddy complexion, and my skin is not sensitive at all, but I do get red from procedures and things that I do to myself or people do to me. And I
But
do,
it's a total myth. It's a total myth that rosacea only occurs in, people of Irish descent or people with very fair skin. Patients such as
100%.
yourself.
I'm so glad you said
Oh
that.
my, yeah, I think it's so underdiagnosed. And it is possible that, if you do get easy flushing or blushing, you may have a little rosacea. It's essentially overreactivity of the skin. Um, I look at rosacea skin like, it's histrionic. It gets, all upset over things that it shouldn't get upset over.
Mhm.
Um, Triggers including spicy foods, alcohol, hot beverages, emotional stress, procedures, anything that makes those blood vessels dilate can make rosacea worse.
I think also in the beauty industry, there has been this myth in the past that the darker the skin, the more it can take, or the tougher it is. And really, I've found that to be the opposite. That people with darker skin tones tend to have more sensitive skin, and they're more prone to post-inflammatory hyperpigmentation. Meaning, like if
Oh yeah.
somebody who is African American, if they get one pimple for that pimple to leave a dark spot on the face for quite a long time. And so I just wanted to throw that out there that
I totally agree with you. I think they're
just
just
because you
different
have darker
issues.
skin.
Different issues in lighter skin and darker skin, but even
Yeah.
just because you have darker skin doesn't mean that your skin is more resilient than anybody else. And I think there are different issues like hyperpigmentation versus redness.
Yep.
Um, and, you know, lighter skin folks tend to form coarse and fine wrinkles a little bit more easily than darker skinned individuals. But darker
Yeah.
skinned individuals tend to develop more keratoses and pigment issues.
Yeah. Okay, that's really good. Let's see. Uh, I'm just reading. We kind of covered a bunch of these. Oh, okay. Here's one that I think I know what you're gonna say, but I'll ask you, and then we'll go to some live questions.
Sure.
Does sleeping on a silk pillowcase really help my skin?
So, believe it or not, there is data showing that there actually are frictional forces between your face and your pillowcase while you sleep.
I love that you're saying that.
There is. There's data. Now, listen. Does everybody need to sleep on a silk pillowcase? Not necessarily, but especially if you are, wanting to fulfill your or complete your anti-aging routine, and you're spending all this money on lasers and facials and skincare products.
Yeah,
What's a little bit more to get a silk pillowcase?
yeah.
And look, if it doesn't match the rest of your sheets, then put it away when guests come over, and then take it out when you go to sleep. Um, but especially if you're a side sleeper or a belly sleeper, this has been evaluated. For a back sleeper, I don't think it makes that much of a difference.
Yeah, I think there are a lot of face sleepers.
Yeah, for
Um,
sure.
People on the side or kind of smushed down. I always tell people I can tell what side of the face they like to sleep on because you're going to have, less elasticity on that side and a little bit more. This is my side.
Yeah, I do think it's true, and you get kind of that vertical,
Yeah.
those vertical lines a little bit more on that one side.
Yeah, I mean, I think that something that you and I have in common is that I like to try my best to look at the data, the scientific data,
Yeah.
um, before I recommend or debunk something. I think that if clients stuck, you can access the data online very easily, and I think that it's better than anecdotal, kind of hearsay. So
Now,
let's
listen,
say
let's get real. If you're not wearing your sunscreen, then who cares what pillowcase you're sleeping on? But
totally,
but once
that's
once
very
you have
true.
your skincare routine set, this is something else that you can add on.
So sunscreen, that was a
Yeah.
question. What is your favorite sunscreen to use? Or what do you
Ooh, that's a
recommend to all
tough
your people?
one. That's a really tough one. So, before I say it, I'll just give you general rules. So, whether you're using a straight sunscreen or a moisturizer with sunscreen, you want to choose a product that has at least SPF 30 and delivers broad spectrum protection. The SPF 30 refers to coverage of your UVB rays, and broad spectrum refers to your UVA. So you need both, and you have to use enough. So we're talking about a quarter-sized dollop. That's enough for your full face. And a moisturizer with sunscreen, while it might be more expensive for a smaller container, will do the same job that a straight sunscreen will do.
Mm.
Um, so there are so many products ranging from your over-the-counter products or your drugstore products, I should say, to your more prestige products. Over-the-counter, I'm a huge Neutrogena fan. The La Roche-Posay sunscreens are great. And then if we're kind of stepping it up a notch and looking to what you can get in Sephora, there are some really unique textures out there. I'm a big fan of the Supergoop products, the Unseen sunscreen. Have you tried that
Me
one?
too. Me too.
It's
I love
great.
Supergoop.
It's
Hmm.
great. So, we'll give Holly
Supergoop
a shout
also
out.
I like because it works for all skin tones. Again, it's not so some of the higher SPFs I feel are so zinky
Yeah.
that it's very challenging to use if you're a different skin tone than very, very fair. But another sunscreen that I really love is MD Solar Sciences.
They're great, those mineral-based products.
Um, they're they have a BB skin balm that is tinted and it's SPF 50 that is very, very lightweight. And again, it blends in no matter your skin tone, which I really, really like. And you can get that on
Yeah.
Amazon. It's not too expensive, but it's more prestige. And it really works well.
There's a new
Um,
brand that I recently learned of called Solara Sun Care. They
oh,
sell it at
I've heard of that.
It's great. They sell it at Neiman Marcus. And it's all zinc based, and it truly does rub in fully without giving you that white discoloration.
That I
Um,
think is really important for me. I like products that are universal. I hate products that can't be kind of used by everybody.
And now that we're
Uh,
indoors, I actually recommend zinc-based products because we're exposed to more HEV light, or the high energy visible, or the blue light. We're on our telephones, we're on our devices, we have our LED light bulbs, and there's data showing that blue light can penetrate into the skin and be associated with early aging and pigmentation. The chemical blockers will do nothing for that, but the mineral blockers may offer some protection.
so I was just going to ask you to define blue light
Oh,
because
sure.
somebody asked me in another forum about blue light. So maybe you could define it first and then say what you just said so people really process what you just said because I think
Sure.
it's really important and very relevant to what's happening right now with us all being at home.
Sure. So if we look at our light spectrum, on one end, we have infrared. Right in the middle, we have our visible light, and that's what gives everything its color. And then on the other end, after the visible light, we have our ultraviolet light. Um, the red visible light sits next to the infrared stuff, the infrared area, and the blue visible light sits next to the ultraviolet. Now, typically when we talk about sun damage, we're talking about those UV rays. So the UVA rays are the longest, then UVB, then UVC. But right next to the UVA, right next to those long wave UVA rays, is blue light. And we know that blue light actually penetrates deep into the skin and can be associated with premature aging and pigmentation. Now, when we say blue light, we can use that word synonymously with HEV, or high energy visible light, exactly the same. And there are a lot of products on the market now that are offering, blue light protection as one of its marketed benefits.
So you would have to, if you wanted protection against blue light, and what in the home would be giving off blue light? All your LED bulbs?
Your LED bulbs, your
Screens.
computer, your telephone, all of that. And of course there
Okay.
is, blue light from the sun as well.
Right. And if you wanted protection from that, you would have to seek out a product that specifically said that it protected against that thing.
So
Um,
many products probably give protection, but there are some that are specifically marketed out that way. So your protection should include an antioxidant like vitamin C, vitamin E, or something else like that, as well as some sort of physical protection from the skin, like you get from zinc oxide as your mineral blocker. So that'll give you UVA and that neighboring high energy visible light as well.
okay, cool. That explains a lot. I think a lot of people have been wondering about that, wondering if they should be worried about that. So that's really helpful.
And
Somebody,
I'll tell you the other thing with your devices, and what I
uh-huh.
love about yours, I need to adjust my stand. Yours is from above. So mine is for below, but the problem is then you get that tech neck. Hold on. There we go. So
Yeah,
we need to keep our head up. Because
yeah,
as we're looking
definitely.
down, it
Well,
definitely can cause
that's,
folding of the skin and those wrinkles.
I mean, I'm about to, it's what I worry about more than anything else. Like when you turn 50, you just want to keep everything under here glued together. So, um, so somebody here just asked a little while ago, I had silicone injections and they are an issue for me.
Yeah,
So do
so
you want to talk about that? I have many clients that ask me about different types of injectables, and I'm curious what you like using, and if you could just discuss um, for everybody who's watching, like why you like it and what's the difference between a silicone as opposed to, a hyaluronic acid.
yeah. So half of my practice is all aesthetic and injectables. And what I tell my patients is that your outcome is 100% dependent on kind of the taste or the aesthetic of your injector. So Monet used paint and Van Gogh used paint, both oil-based paints, but they look really, really differently. So it depends on how your injector, sees your face. It's like art class. So there's kind of how you see the canvas, and then there are the tools that you use. So silicone is not really used that much anymore. It is permanent. You cannot get rid of it. In some cases, if it does cause a reaction in the skin, there actually have been some surgeons that have actually excised it, just cut it completely out.
I've heard of that. Yeah.
And I do have a patient who, is a high profile actress who unfortunately, had this done and, has periodic reactions to it. So we try to, get it under control. But once
Reactions to the silicone.
silicone that was put in, 20 years
Wow,
ago.
that's scary.
So I don't use silicone at all. I don't use any permanent fillers. I am using 99.99% I'm using hyaluronic acid fillers.
And is
So,
that
okay.
just Restylane, or are there other versions of it?
Yeah, so I'll just tell you, so HA, or hyaluronic acid, as I'm sure you know, is a natural sugar that's found in the skin, and it actually has been isolated and produced in the lab and then cross-linked or stabilized in a gel form that can be injected. And the biggest companies that we have right now is the Restylane franchise and the Juvederm franchise. They both make great products, and you can do a lot with the products in both of those companies, and it just comes down to personal preference.
Got it.
I'm using both. One of my favorite products right now is called Restylane Lift. 10 years ago, when it hit the market, it was called Perlane. It is probably one
I
of the
remember
oldest products.
Perlane.
That's now it's Restylane Lift. I love it. And you know, the products have different properties. They can either be what we call particulate fillers. So I want you to think about something like kinetic sand. If any of you guys have kids out there, I have a 9-year-old and a 7-year-old, so they play with this kinetic sand. So they're little particles that kind of stick together. So Restylane Lift, we can think about as being a bunch of boulders. They're large in size. Regular Restylane are pebbles, and then Restylane Silk are little grains of sand. So we use them at different levels and in different areas. Then we have more cohesive products, and that's really what the Restylane Refine and Define are, as well as the Juvederm products. And you can think of these kind of like the way to think about honey versus maple syrup. It sticks together and it's smushy, but different viscosities.
Got it. And so
Um,
would you choose to use one or another? I don't need it anymore. Would you choose to use one or another in depending on the area of the face that
yeah.
you're
So
injecting?
if you're thinking about like the mid face, you're talking about the cheeks, you're talking about the temples, the chin, the jawline. You're probably going to want structure. We're talking about forming anchors or buttresses on the face. So you want that boulder. Or there's a product called Juvederm Voluma, which is a highly cross-linked product, and they give good lift. You have to think about what you want to accomplish. Do you want to fill, or do you want to lift? And oftentimes, a lot of my patients, and if you look at me, you know, I have a full face. I don't really need volume. What I need is height. Um, and that's what I give to a lot of my patients. And
Yeah.
you need to kind of I like to recreate the upper face first, give the lift that you need, then work my way down. I typically am not treating these folds much at all. I think that's an old way of doing things. You want
Totally.
to get to the root of what causes the fold to begin with.
I love that because I think that the art of injectables, I don't necessarily endorse nor look down upon anybody who gets them. I think if it's going to make you feel good, then go for it. I truly think that. And if it won't make you feel good to do or you have some issue with it, then don't because there's lots of alternatives to that are non-invasive. If you're
But I'll
willing
tell
to look.
everybody, you know, when done properly, they are very safe and very effective. And the HA
Safety,
fillers,
absolutely. Yeah.
they're completely erasable. So, you know, I say even the best artist needs an eraser once in a while. And if there's a little, you know, there's a little asymmetry, it's a little too full, there is an enzyme that we use that will dissolve it. So that's why I use those products. And then there are other fillers on the market. There's one called Sculptra,
Uh-huh.
which is really more of a volumizer,
Hmm.
which, you know, just for my patient population, I happen to like the HA fillers. And then there's a product called Radius. This is a calcium-based product. It has among the highest lifting properties, you know, for that cheek to get you up there. But the problem is that for a long time it was completely irreversible, and now there is something that you can do to try to dissolve it, but it's much more difficult than an HA filler.
I can imagine just based on the fact that it's calcium based.
Yeah.
Um, that's interesting. Okay, cool. I like where this is all going. Okay. Any treatment for laser with large pores, someone asked.
Um, Pores are tough, you know, so everybody wants to have no pores. My best advice is to get a good filter on your telephone and you can just erase all of them. But
Yeah.
in the real world, you know, our pores are genetically determined, but when we make oil, the oil goes into the pore and dilates it. So high oil levels will make your pores look more prominent, as well as dead cells on the surface of the skin. So we want to wash our face well using hydroxy acids. We want to using ingredients like topical retinoids, which, and I'd love to hear your opinion on retinoids. Um, but the retinoids increase cell turnover and stimulate collagen and basically enhance the structure or the support around the pore. And
Mm-hmm.
then you want to make sure you're exfoliating properly. And then, the question that she had was the lasers. So again, our multitasking laser Fraxel can help stimulate collagen. So any of those resurfacing lasers that stimulate collagen will give more structure and support to the pore and make it appear smaller. But we really cannot get rid of them altogether.
Yeah, I pretty much tell people pore size doesn't change, but if you keep them clean, it will reduce the appearance of them.
Exactly.
I love retinol. I have a retinol product in my line. I
Yeah.
do recommend it for pretty much anybody, unless they have a particular issue with retinol. It just works. There's science behind that. And then I always tell people, because a lot of middle-aged people complain about pore size. I always tell people as you lose collagen, it kind of your skin is sort of sagging a tiny bit. It makes the pores seem a little bit bigger,
A
you
hundred
know,
percent.
than what they were when you were younger, but they didn't change size. And so you want to focus on collagen stimulation and treatments that will assist in, kind of giving you a natural lift to your skin, and then that will help.
And it's a
But I,
long game. No one is going to see improvements from retinol overnight. And it's something that you need to build up a tolerance to. I'm sure you've seen it in the first 2 to 4 weeks.
yeah,
We know it causes irritation. So I typically have people start intermittently every other night or so
yeah,
and make sure
same,
that you combine it with a moisturizer. Um,
yeah.
and if you keep using it, just like we talked about clear and brilliant laser, or we talked about treating hyperpigmentation, the same is true when we use retinol.
Yeah. Okay, so CT Local Treasures Cool Finds. Hello from Connecticut. What treatment would you recommend for facial redness and broken capillaries?
Yeah. So the treatment would be twofold. So broken capillaries, um, look at those kind of like a done deal. They're there. The only way to really get rid of those is with some sort of physical modality. We're talking about treatments like intense pulse light, or what I do a lot of is a laser called the V-beam. This
Mm,
is a laser that emits a beam of light with the color green. And green is optimally absorbed in the skin by the color red. And where is it red? In the broken capillaries where you have more blood vessels. So we can selectively target them and actually destroy them. And hopefully, in many cases, they don't even come back.
that's
For the
awesome.
background redness, now we're getting back into the conversation we had before about skin
Sure.
sensitivity and rosacea, and we're really talking more about good skin care.
Yeah, I mean, I typically, for any type of redness, even with rosacea clients, I also typically recommend that they do LED light therapy
Yeah,
as a way of stimulating collagen production. It reduces inflammation. So if you do have redness due to any type of sensitivity or inflammation, typically it will improve it. If you have severe rosacea, obviously that's it's a medical condition, and you need to see a derm about that. And there
but I
is
think in rosacea, your skincare routine is just as important as your medical routine. Using the wrong cleanser, the wrong
sure,
skincare products can make it worse.
yeah. Um, this is just a question that I thought of when you were talking. What would you do about stretch marks? I get this question all the time, and obviously, my answer from my side of things is that aesthetics wise, there's not really a lot that I can do. So I have in my office an LED light bed, which
Yeah.
I'm the patent holder. It's top and bottom. You get it
Mhm.
naked, and that will help improve the appearance of stretch marks over time, just because it improves the skin overall. But there's nothing that I can do.
Well,
There's no
that's
real.
the same approach that we have professionally in the office. Um,
Mhm.
well, there are two components to stretch marks. You have the color, and then you have the texture. So new stretch marks tend to be red.
Okay.
And that same laser, that V-beam that I use for capillaries, I use as well to get rid of the red of stretch marks.
Oh,
Once
cool.
that goes away, they look kind of pale and what we
White.
call atrophic or thin. So the goal is to stimulate collagen. And again, I'm coming back to my Fraxel laser at the deep setting, similar to what I use to treat scars, acne scars, to stimulate collagen, help kind of restructure the deeper skin layers and help it look a little bit better. And I know people are also using microneedling. I personally am not, but I know it's being used.
I'm obsessed with microneedling with radio frequency
Yeah,
combined. We started doing it in the office this fall, like in November, I think it was.
yeah.
We trained for a year, and the results are incredible. And it's kind of like going back to when we first started the discussion about how you said that Fraxel causes deeper damage. As an esthetician, I'm not like a huge fan of people doing the rollers
Hmm.
on the face, that superficial poking holes in the skin, because for me anyway, it just stimulates my melasma really badly.
Yeah.
But with with the machine that's stamping the
So
skin.
do you have one of the pens?
No, I have, do you know in mode?
Yeah, yeah, yeah.
I have that machine.
Oh, great.
And so it stamps needles in and then you shoot radio frequency once the needles are in there. It is like, I mean, for me, I see a difference right away in everybody and it really addresses fine lines. Up here is really great. It's very tightening.
And I
So
think you do need that combination treatment because by punching those needles into the skin, it gives better targeted delivery of the radio frequency than if you just did some device on the surface.
yeah. So somebody is asking if you have a recommendation for KP, which is keratosis pilaris
Yeah.
for anybody. Do you want to explain that really quickly? Because we're running out of time, but
Sure.
what
So yeah,
keratosis pilaris is?
so KP or keratosis pilaris, sometimes referred to as chicken skin, are basically prominent pores that you typically get behind the arms on your tricep area, sometimes on the thighs or even the buttock. And it's caused by accumulation of cells that essentially get stuck within the pores. So it's different than real acne, but in many ways is similar. So I tend to use either hydroxy acids or retinoids, like retinol. But I usually use lactic acid. There's some lactic acid-based moisturizers that are very reasonable, come in large sizes, and can be used regularly without irritation.
Is there some one in particular that you like?
So the one over the counter that I recommend is amlactin, and I think it's about $25 at your local drugstore. Or there
What's
are
it called?
prescription amlactin, AMLA. Oh, I'm sorry. Wait, amlactin, one of the lachydrin or amlactin? One's prescription and one's over the counter. Maybe I just completely misspoke.
I don't know. I'm not familiar with the product. I typically also recommend, I think it's Dr. Dennis Gross has, like glycolic pads.
Or those alpha betas that he has.
Yeah, something like that could work, or just like a body scrub of some
Yeah.
sort, just to keep it. The idea being you clean it out by exfoliating on a
And
regular
don't
basis.
pick it. That's just don't. It makes it so much
Yeah.
worse.
Yeah, I mean, picking in any form, whether it be on the face or the body for any reason, I'm a trained esthetician and I wouldn't pick anything on myself because you can't see what you're doing. You're just going to make a mess no matter what. I'm going to see if there's one more question that we can answer before we go. Um, this is good. Do I need a different moisturizer for the neck area?
Um, Good question. So if you ask the skincare brands, sometimes they say yes.
I
Um,
say no.
there are a lot of products, and there's no reason that you can't use your face care product on your neck as well. However, there are skincare products that do contain certain ingredients, whether they form a scaffold on the skin to give a little bit of tightening, whether they have specific antioxidants or collagen stimulating ingredients like retinol at in specialized formulation to minimize irritation on the neck. So there certainly is no harm in using a specific neck cream, especially if you're a little bit older. But for younger patients, you definitely can start out with the same product on your face and on your neck.
I mean, I don't, at least from my clientele, I don't see that many people actually doing it. You
Yeah.
know, I don't make one because I think it's silly to, I mean, the skin on the neck is definitely, I notice that it has a different level of elasticity
Yeah.
than my face. But at the same time, like, there's no reason why my face products wouldn't work on the neck. And I definitely also treat the décolleté because as you age, you get the sun damage comes out a little bit more as you get older. And I always bring, I'm always like this with
Well, I've been
everything.
married for 10 years now, and I remember it was probably like my third date. I told my wife, you know, you're done with these low cut shirts. She's been wearing like crew necks, you know, for 10 years. And she like hates me for it, but her chest is in good shape because I think we caught it early enough.
That's funny. Are you sure you're not Latin? If my husband were here, he'd be like, exactly. um, okay, so one last one, and I think we're going to run you guys.
Sure.
Have you ever tried electric muscle stimulation for the face?
So actually, the electric muscle stimulation is really a hot topic right now because there are several devices on the market. One of them is called M-Sculpt, and it's being used, you know, for your booty and for your belly.
We do it in our office. We
Oh,
have
it's what do
M.
you think about it?
I honestly love it. It's really, really popular for, it's not gonna like, look, if you're, how do I want to say it? If you want to address a problem area, it will, studies have shown that it does tighten that area, but it's not going to magically, you're not going to lose 20 pounds by
No.
doing a series of M Sculpt. And I like to be really honest about that. But if there's something that bothers you, that your self-esteem would be improved by working on that one area, it's awesome.
Well,
What were
I
you
would
going to
like an
say
M
about it?
Sculpt for my apartment to use every night. Then I wouldn't need the mirror.
I know, wouldn't that be awesome? I remember years ago, I had a friend who was from Europe, and this was when I first became an esthetician. The mom used to say, I hate doing exercise and I hate drinking water. So she would go and get microcurrent on her body
Yeah.
instead of going to the gym. I mean, she looked fine then. I don't know how that was going to go for her as she got older. I wouldn't recommend that as a
It's all about
replacement,
balance.
but yeah, yeah. Have you ever tried M-Sculpt?
I haven't. You know, we don't have one in the office. You know, I just think there are so many people in New York City that have it, and I was a little late to the game. So I'm just going to concentrate on my face care and leave the body to
I
everybody else.
understand. I understand that. I
Uh,
I don't add in things that I feel are out of my focus for that reason. Same thing. All right, man. This was really awesome.
this was great.
I
So
had
everybody, really
so
quick.
much
So
fun.
Joanna and I kind of met randomly at an event that we both were at. So this is great that we were able to connect here.
Yeah, we were at a skincare event thrown by some mutual friends of ours. And we didn't get a chance to really say hi to one another, even though we both recognized each other just because we were talking and everything. But this was such a pleasure to finally get to hang out with you
You too.
and to hear about all of how you think about everything and how you do things because, there are so many clients with all of these questions, and I think we boiled down some really important topics. So thank you so much for joining me
Yeah, thanks for having
on
me.
my
This was great.
couch. And to everybody who watched today, we wish you well. Stay safe. Stay at home. We're in this together, And if you guys have any follow-up questions for either Dr. Zeichner or myself, please, you can DM us. Thank you so much for being here and taking
Thank
time.
you. Great to see you.
And hopefully we'll get to hang out one of these days very
I know.
soon.